Bismillahirrahmanirrahim. This is a presentation about a common skin lump which is known as epidermal inclusion cyst. Now, to start with, I'll start with a clinical photograph. This is a photograph of a subcutaneous lump. This is present on the thigh, on the upper thigh, on the medial side of the upper thigh. Uh, this whole lump is the uh, skin lump, and in the center there is a uh, colored area, darkish area, which is known as the punctum. It's a subcutaneous lump. It's not painful. It's small in size, and there is a presence of uh, colored area over here, which is known as punctum. Now, this is typical of epidermal inclusion cyst. Uh, it's also labeled as a sebaceous cyst, but it's not a sebaceous cyst. Sebaceous cyst is due to blockage of a sebaceous duct, and the contents of the sebaceous cyst is sebum, whereas content of the epidermal inclusion cyst is keratin. Now, how does it form? Epidermal inclusion cysts are benign fluid-filled lump under the skin. Uh, Skin has got two layers, as we know, dermis and epidermis. The epidermal layer is has got keratin, which sheds off, and a new keratin forms from the bottom layer and goes up. So this shedding off, sometimes it may implant underneath the epidermis, and this implantation of the epidermis into the dermis may become an nidus for formation of a epidermal inclusion cyst. The diagnosis of such a lump is fairly easy the because of the presence of punctum. On physical examination, you see a subcutaneous nodule, not painful, small in size, with a central uh, punctum present, and usually patient comes worrying that this may be something more sinister. I had a patient who had a similar lump on the breast, and she was really very much worried about that this may not be a carcinoma, but it was fairly easy diagnosis. Uh, so diagnosis is very easy, and the treatment is if it's a if the patient is really worried about it, usually they do not require any treatment. But if the patient is very worried about it, you can excise it under local anesthesia, and that will be curative. You excise the lump along with the overlying skin and approximate the rest of the gap by suturing the skin, and that's a curative treatment. I'll got a lump over here. This is excision excision of the lump. This is the elliptical skin incision which was made. That's the skin, and underneath is the cyst, which is epidermal inclusion cyst. And on opening the cyst, you can see the content. The cyst has been incised, and these are the contents. The contents are blackish color in color, very foul smelling, and these contents are keratin and debris. Now I'll show you a histological picture. One of the cysts, we examined it under microscope, and you can see this is the inclusion epidermal cyst. The lining is of the stratified squamous epithelium. That is the epidermis, which has gone into the dermis. And this is the cystic cavity, which contains keratin and debris. So this is inclusion epidermal cyst. And now you can see certain appendages of the skin over here. These are sebaceous glands, and this is hair follicle over here. And there's another hair follicle over here. That's in the dermis. So this is all about epidermal inclusion cyst, which is mistakenly labeled as sebaceous cyst. Inclusion dermoid cysts are more common, much more common. Sebaceous cysts, true sebaceous cysts, are extremely rare. Thank you.